This is a trial with E7820, which is an RBM39 degrader, which is intended for patients with relapsed refractory myeloid malignancies, so AML, MDS, and CMML, that have splicing factor mutations. So this is a patient population where there's really no good treatment option. And splicing factor mutations are also something that has been identified as not being really responsive to current standard therapies like venetoclax-based regimens. So what this was, it was a multi-center phase 2 trial that was open at Memorial Sloan Kettering Cancer Center at the University of Miami. And we treated patients with the recommended phase 2 dose of E7820, which was previously identified in patients with solid tumors. And then this is essentially the first look at the data and see if there's like a preliminary signal for efficacy as well as for safety. And we've enrolled 12 patients so far, and unfortunately we've not seen any response. So the best response was a marrow complete remission, which was very transient in one patient with MDS. There were also no hematologic improvements. The best response in the other patient was stable disease or even progressive disease. However, treatment at the recommended phase 2 dose was found to be generally safe. So correlative studies are in process. So there might be a rationale to combine E7820 with other treatments. For example, there's preclinical data from Dr. Abdel Wahab's lab that showed that there's a potential synergy of splicing modulators with immune checkpoint inhibitors in preclinical models. So this might be something to consider. There are novel RBM39 degraders that are in development. But unfortunately, the trial so far has been negative. We've not seen any responses among the first 12 patients. But at least there was no unexpected toxicity signal.